Hi, I'm Sarah Gray. I'm a psychology student at the University of New England.
And I'm Dr. Ashley Shaw, and I'm a licensed clinical psychologist and also an assistant professor of psychology at the University of New England.
We're just going to ask you some questions about graduate school and psychology.
Perfect.
All right, so can you explain the difference between master's and PsyD and PhD programs?
Great question. So this is important both to know if you're looking for a therapist, but also if you want to be one, that there are differences between those degrees. So a master's degree is something that is much shorter. So that's a nice thing about it. So oftentimes we have like 2-year master's programs you can do, and then you do an internship afterwards to be able to get your license. Now PhD and PsyDs take quite a bit longer. So PsyDs typically take 4 years of study plus internship, and then PhDs typically take 4 to 5 years of study plus internship. And for both PsyDs and PhDs, you also have to do a postdoctoral fellowship afterwards. So the training for doctoral level clinicians is about double that for master's level clinicians. That being said, there's a lot of overlap in what you can do with those degrees. Now, it's important to also point out the difference between PsyD programs and PhD programs. And actually, this is a relevant one for master's programs too. So if you get a PhD, oftentimes those programs are going to pay for you to go to school. So they will give you a stipend to live upon. It's nothing glamorous, but you do get a stipend. They also pay for your tuition. That is typically not the case for PsyD and master's programs. So you are paying for yourself to go to school and you are not bringing in income. Now, sometimes there can be opportunities to be a teaching assistant or bring in money in some small way, but that's automatically built into most PhD programs. Now, a primary difference between the PsyD and the PhD is research. So for PhD programs, a big portion of what you're doing in addition to clinical training and clinical work and coursework is doing research. So you'll be doing your own master's thesis, your own dissertation, working in a lab, and that's not something that is necessarily built into PsyDs and master's programs, though sometimes you may have opportunities like that on a smaller scale.
What sort of licenses do master's level clinicians pursue after finishing their program?
Great question. There are so many different licenses, and it's almost hard to keep track of all the acronyms. So one of them is a licensed marriage and family therapist. That's an LMFT. LMFTs are the type of degree you'd want to go to if you're looking for a family therapist or couples counseling. Now, that doesn't mean other people can't do family therapy and couples counseling. So for example, there's a lot of PhDs that specialize in couples therapy. However, they did their entire training really focused on not just the individual, but those relationships. And so that's their kind of expertise and bread and butter. Now, there's also licensed clinical professional counselors. They are more so trained in doing therapy and counseling. Then you also have licensed mental health counselors, LMHC. They also are trained to do counseling and therapy. And I think I'm missing one. Oh, licensed clinical social worker, LCSW. So licensed clinical social workers can also do therapy, also receive training in therapy, but they also have a background in case management. So they can do things that you might not be as well suited in other mental health fields, like knowing where to point somebody who's homeless in the direction of getting housing or resources like free food stamps and things like that. So they can kind of give more kind of wraparound comprehensive services to the client.
So what kind of jobs can you pursue with a master's degree or a doctoral degree?
Great question. All sorts of jobs. So I would say, so it's interesting because some of these degrees you could have a similar job. There just may be a pay differential. So, for example, a master's level clinician a PsyD and a PhD level clinician could all potentially work at a hospital, right? So they could work in an inpatient setting, they could work also in outpatient services, so they could work in community mental health, they could work doing outpatient therapy. Now, what's different is who can work in schools. So generally speaking, it would be more unusual to see somebody with a clinical psych PhD in schools. More often, you're going to see somebody with like a school psychology degree or a licensed clinical social worker. Trying to think of other examples. These providers can work really in a range of settings. There's also, in addition to sort of thinking of your general private practice, there's also all sorts of higher levels of care. So sometimes when patients have more needs, they might be seen in a residential setting, they might be seen in an intensive outpatient setting, and people with all of those types of degrees could potentially be in that setting, although school psychology would be a little bit more rare. Now, with a counseling psychology degree, oftentimes that's preparing people really well to either work in a school setting or a university counseling center.
Thank you. So what are some important things that to look for in a doctoral program or a master's program?
Great question. So in terms of a doctoral program, if we're thinking about PhD programs, one of the things to keep in mind is that you actually get matched with a research mentor. So if you think about, faculty members you've worked with in undergrad, you maybe see them like up to, I don't know, if you work in their lab 10 hours a week, this is somebody you're going to work with closely for 4 to 5 years. So there really needs to be a good match in terms of your sort of interpersonal styles, but also like the research that you want to do. So that's one thing that can be really important. You also want to think about what sort of experiences you want to get clinically. So what sort of practicum sites would they send you to in the community that you could get experience with? Another thing to consider is sometimes these programs have tracks. So for example, where I went and got my PhD, there was like a health psychology track, a child track, an adult track. So some people, when they really want that specialty training working with children or working with people struggling with health conditions like cancer, they might really want to get kind of that special niche experience. Now, one thing to consider for programs where you don't get a stipend, so like a PsyD program or a master's program, you want to think of things like the student to faculty ratio, so how many other students will be in class with you. You want to think about how long it takes to complete the program. You want to think about cost. I have heard that there are occasions where you can get paid to do your master's, or you can at least get some opportunities to bring in an income while doing that. So that's something I would definitely look into. You also want to look at things like acceptance rates. So PhD programs can be really competitive, but some of these masters and PsyD programs, you want to just kind of be aware of, like, are they accepting everyone, or is it kind of competitive to get into the program? Are they selective in kind of wanting to make sure they're getting people that would be well suited in this career? Another thing to think about is the level and quality of supervision you're getting when you're doing clinical work. So there's all different models of supervision. Sometimes you might get an hour of supervision one-to-one with somebody per week. And another time you might get group supervision where you're getting a lot less one-on-one attention. Neither is necessarily better or worse than the other. However, you want to kind of think about the earlier you are in your training, the more hours of supervision you want to be offered and the more close supervision you want to be offered. So it can be nice, especially thinking about when you're first starting out, that opportunity to have one-to-one supervision. Just to give you an example, in my doctoral program, we got 1 hour of individual supervision for every 3 hours of therapy we did. So like that's like a pretty good ratio, right? Whereas in some other settings, you might be asked to do a lot of face-to-face work with clients and not get as frequent of supervision. So I think that would be a good thing to look at too.
Thank you. So what steps should students be taking now in their undergrad to prepare themselves for graduate school?
Great question. So it really depends on the type of graduate program that you're looking for. If you're really interested in pursuing more of a clinical path, getting clinical experience is good. And also thinking about when you're picking out classes, leaning towards those more clinical classes. Luckily, because we have a number of clinical psychologists at University of New England, we have a lot to choose from. Like theories of clinical and counseling psychology, which I know you're taking with me, abnormal psychology. So you want to think about crafting your course load to kind of highlight that interest, right? And you also, if you can get an opportunity to get clinical experiences working with patients beforehand, that would be great. Another thing to think about is if you're trying to go into a direction like school psychology or a child track of a clinical psychology program, you want to get experience with kids. It doesn't necessarily have to be like being their therapist. Even if it's like working at a camp or tutoring, just kind of showing that you have experience working with kids and getting along with kids, I think it can be good experiences. When we're talking about a PhD, whether that be a clinical psych PhD, school psych PhD, you're also going to want to get research experience. So working in a lab during undergrad, maybe even doing a poster at a conference or writing a manuscript with the faculty member you're working with. Those things are essential. The other thing is, more and more, they're suggesting before getting a PhD that you do what's called a post-baccalaureate research assistant. So you take on average 2 years after graduating to work in a lab full time. And that really helps build up your resume. You can kind of write papers during that time, get more experience with data analysis, things like that.
Do you have any final advice for students who want to pursue a career in this field?
Great question. I think that what I would say is don't rush into it. Think through your options, think through the financial feasibility of it for you, right? I also especially wouldn't rush into a PhD program unless you really love research and you're like sure about that. If you really do want to be a clinician, there are so many ways to do that without having to do a dissertation. So keep that in mind. There's so many different ways to be a therapist or clinician without having to go through the PhD process. I think that's it.
Yeah, so thank you so much for answering all these questions. It was very helpful.
Absolutely.